Diarrhea is defined as an increase in fluidity and frequency of stool. Normally, an healthy human individual defecate about 200 grams of stool per day. That is normal. But during diarrhea, more than 200 grams stool containing 70 to 95% water will be produced, and the frequency increases up to 5 to 20 times a day. So that indicates the severity of the problem. And the main problem is dehydration. So water level comes down, then it leads to many other severe problems. In severe cases, 1.4 liter water will be lost during diarrhea. So that will be attended at the right time with the proper treatment. And we should understand what is the reason behind this, and we have to go appropriate treatment for diarrhea. Dysentery is called low volume bloody diarrhea. That is called dysentery. If there is no blood excretion, then it is normal diarrhea. Diarrhea may be due to ingested contaminated food or water with virus, bacteria, and protozoal pathogens. So we should identify the reason behind diarrhea, the source of diarrhea, either the contaminated food or microbial origin, that is or which category microbes. So that is by stool examination only can confirm. So initially, immediately to symptomatical relief, we have to attend with the pharmacological therapy. Causes of diarrhea, we can find many causes like this. Either it may be bacterial, viral infections caused by parasites, germs, is a one type of virus. Sorry, diarrhea, and water consumption is not sufficient. So that is the water may be a reason. Excessive consumption of alcohol is also a reason. Intestinal disorders or diseases may also result diarrhea. So maybe disorders in the intestine, maybe absence of peristalsis, like that problems. Incomplete digestion of food, that is also a reason. Overreacting, overeating. Overeating may results diarrhea. Overeating habits also results diarrhea. So by counseling only, we can come across the exact reason for diarrhea. Pathophysiology of persistent diarrhea, if you analyze uh, persistent infections, associated infections, urinary tract infections, acute otitis media, pneumonia, it is inflammation in the ear, otitis, sepsis and bacterial origin infections. These all genetically occurring problems. And then lactose intolerance, cow's milk protein allergy, fat allergy. These are some reasons. May result problem. And these all result finally malnutrition, because of this continuous diarrhea, people will not have proper food, and absorption will be poor, malnutrition, and malabsorption. Even though they are taking food, this will not be absorbed. Impaired immunity, T cells, B cells, zinc deficiency. These also results microbial attack. So that facilitates microbial attack. So that leads to these problems. And prolonged villi injury. Villi are the absorbing units present in small intestine. Their injury also results small absorption. And partial villus atrophy and persistent diarrhea. So these are the reasons finally it may result. Pathophysiology, diarrhea occurs due to imbalance between absorption and secretion of water and electrolytes. It may be associated with specific diseases of intestine or secondary to the disease outside the intestine. The principal mechanism of diarrhea is change in the active ion transport by either decreased sodium absorption or an increased chloride secretion. So sodium absorption will be decreased or increased chloride secretion. So what happens due to osmosis? the water level will be higher in intestine, inside the intestine. The change in intestinal motility also a reason. Excretion will be very quicker. Increase in luminal osmolarity. So because of the osmolarity changes, because of these absorption changes only, presence of electrolyte variations results accumulation of fluid inside the intestine. That results watery stool. Increase in tissue hydrostatic pressure, malabsorption. These are the reasons, pathophysiology behind diarrhea. Management. Prevention of excessive water and electrolyte loss are the main strategies in the management of diarrhea. So symptomatic relief only we should think about in the beginning, because water loss is higher, patient become very weak. So immediately they should be admitted as an inpatient and be treated. Non-pharmacological management are eating balanced diet and avoiding solid foods and dietary products at least for 24 hours. In replenishing the lost electrolytes by oral rehydration salt. That is the instant therapy we have to try. ORS formula can also be made at home by mixing a pinch of salt into 200 ml of water and cooled water with 1 teaspoonful of sugar. So the salt and sugar mixture, 2:1 ratio, that should be administered as an instant ORS therapy. Pharmacological management. If the problem is very severe, the patients will be admitted in hospital. We have to think about pharmacological management. First thing is anti-motility drugs, because the peristaltic movement is very high. That is only excretion is high. So anti-motility drugs may slow down the excretion. These drugs delay the transit of intraluminal content or increase the gut capacity, prolonging the contact and absorption. So the food may result in the intestine for longer than a longer duration, and thereby may have more duration to absorb. So patients may get nourished. That is one way of treatment. Double purpose. One, excretion is also delayed and absorption also improved. So loperamide like drugs used in acute and chronic diarrhea conditions. Initially 4 milligram, then 2 milligram after each stool excretion, but should not exceed 16 milligram per day. So that is the dosage for loperamide. There comes under anti-motility drugs. Then adsorbents can be used. The adsorbent role is they absorb water content of the stool and they make it less water content. So quick excretion is stopped. Adsorbents are used to provide a symptomatic relief. Kaolin, pectin. They can be used, gives at a dose range of 30 to 120 milligram after each stool. They become gel and intake water which is present in this with the stool present in the intestine. Thereby it become semi-solid. So quick excretion is stopped. Anti-secretory agents can be tried. They are often used to treat traveler's diarrhea. Example, bismuth subsalicylate. Anti-secretory agents. They prevent the secretion of mucin in the intestine in higher rate. So the water loss is prevented. Then bacterial replacement agents can be tried. That is probiotics like Lactobacillus preparations are intended to replace the colonial microflora. Sometimes after antibiotic therapy, the colonial microbial flora in the intestine may also totally vanish. So to replace them, we have to go for Lactobacillus preparations, oral therapy. So that will regain that bacterial flora. These flora may act against many parasitic microbes that may leads to diarrheal problem, and it may induce diarrhea like amoeba and all. So these bacteria may act against those microbes, so they protect us. So this flora is helpful restoring the intestinal functions and suppressing the growth of pathogenic microorganisms. and also they producing byproducts like vitamins, vitamin D complex. So these bacterial flora should be always present in the intestine to have an healthy environment there. So that preparations can be used. Osteroid, Asteroid, Asteroid. It is the synthetic analog of endogenous somatostatin. It is given to the symptomatic treatment of carcinoid tumors and vasoactive peptide secreting tumors. In the case of cancer formation, these problem may occur. That may also induce diarrhea. That is due to disorders in the intestine. This problem is there. So in such case, this therapy may be helpful. It acts as a acts by blocking the release of serotonin and other active peptides and thus controls diarrhea. So octreotides are synthetic analogs of endogenous somatostatins. They symptomatically give relief, stop the secretions comes from tumors present in the intestine. Antibacterial agents may be helpful if you found that it is a bacterial induced diarrhea by stool examinations. Then we can go for fluoroquinolones such as norfloxacin 400 mg or ciprofloxacin 500 mg, ofloxacin 200 mg. Combinations of fluoroquinolones and anti-amoebic agents are also used to control ineffective bloody diarrhea. So amoeba is another parasite that induce diarrhea. So normally norfloxacin, metronidazole, tinidazole, that anti-amoebic drugs also will be given in combination. So that is the treatment for diarrhea. Next symptomatic, minor ailment is constipation. Constipation also looks like a very common problem. A simple problem may also have many other severe problems at the background. So it should be assessed properly in a community pharmacy setup. What is the reason behind by analyzing the food habits, lifestyle, and drug therapy of the patient who is continuously taken by the patients. So constipation is defined as an infrequent bowel action of twice a week or less than involves training to pass hard stools accompanied by a sensation of pain or incomplete evacuation. This maybe looks like a very simple problem or occasionally may happen. Some patients may regularly have this problem because of their lifestyle. And if this continues, then it leads to severe inflammation in the intestine and things may become very worsened. So constipation appears to be more common in up to 20% in elderly people and 8% in middle-aged and 3% of young people they are having this. The why it is higher in elderly patients because of the weakness and the poor peristalsis and other comorbid conditions only. Causes of constipation is ignoring the urge to ignoring the urge to defecate, environmental changes, ingestion of low residue diet, immobility, emotional stress, ingestion of constipating foods, that is poor fibrous foods, and use of constipating drugs like opiates, anticholinergics, calcium and aluminum antacids, chronic misuse of laxatives, decreased fluid intake. So you see the variety of reasons listed here for constipation. So by proper counseling of the patients only, we can come across the exact reason for constipation of the patient. See, if the patient is continuously taking laxative like drugs, and